again so much for everybody coming here. This is a very nice crowd, and I think that speaks to the need for all of us to be more aware of our hearts, and particularly how stress affects us on a daily basis. And so today, we're going to be spending some time talking exactly about stress. What is it? Now, we all think we have some kind of ideas about it, but what's the difference between maybe good stress and bad stress? And what can we do to kind of help manage this? Another thing we're going to be focusing on is identifying the underlooked symptoms of stress. Now, all of us might sit here and say, yes, of course I'm stressed out. And some of us might sit here and say, well, I don't know. If you identify with any of the symptoms that we've talked about, it might be helpful to do kind of a self-assessment, so that way we can make sure that we're actually paying attention to what our body is telling us about what's happening maybe in our environment or in our minds, okay? Then we're going to move on and talk about the effects on the heart specifically. If you've been to other Lunch and Learns, we've talked about how stress can affect us in terms of our eating behavior, or how stress can affect us in terms of diabetes. But today, because it is Heart Awareness Month, we're going to be really focusing on its effects on the heart and what we can do to help to mitigate that, because there's a lot of self-management techniques, there's a lot of things that we can do as patients to really help to improve our cardiovascular health. And that's really the biggest missing piece a lot of times. It's not so much going to the doctor or the medications, it's what we can all do at home to be better patients and to be healthier. So, with that said, as Patty kind of mentioned, if you have any questions about this while I'm going through the presentation, always raise your hand. I'll be happy to answer them right then. I'll try to stop a few minutes early, so if you have any you want to address with me, then please do so. Also, if you're thinking about this later on and can't remember something that we discussed, all of our Lunch and Learns are being recorded, put on our Facebook page as well as our website. So you can go back and look at this. Maybe you hear something today that relates to a family member or a friend, somebody you go to church with. If that's the case, you can use this as a directory to kind of get them into this, and then maybe that can help get them in the door to help. So please utilize the resources that we have here for you today. All right, what is stress? This is one of the best definitions I think we have out there. Stress is a perceived disconnect between a situation and our resources / ability to cope, okay? So it's perceived, and that's the big key word in this. Stress does not always arise from an actual threat, but if we perceive it to be a threat, then it's a threat, okay? A good example of this, whenever I was kind of trying to help and come up with some things that make it very relatable, is maybe a roller coaster ride. Some people really enjoy going on roller coaster rides. They see it as a very fun activity. Other people, absolutely not. Most stressful thing in the world. Another example that sometimes I see patients with in my office is a fear of flying. Flying to them is absolutely terrifying, and it's a big stressor on their life because they have all these preconceived or conceived notions about it. Other people, flying is fun. I love to fly. Anytime I can get up in a plane, I'm having a great time. But again, this is perceived, all right? So whenever we're talking about these things, be very mindful of that. All right, now good stress versus bad stress. Good stress, what we're referring to in this case is an acute stress. And acute means short term, okay? Our body is actually designed to experience small stress or short-term stress. It was actually an evolutionary kind of response to real natural dangers, okay? Back in the day, cavemen, let's just use as an example, weren't worried about paying bills, right? They weren't worried about having to manage maybe aspects of their health care at that point. Their experience of stress was based upon real things that were happening within their environment, right? Getting ready to get eaten by a bear, right? Having a thunderstorm kind of come up. Those were the things that served as stressors back in the day. But as our mind and our brains have kind of evolved, they have now taken on the form where our stress turns into worry and comes from things that's not happening in the here and now. It comes from things that are future-based, right? It comes from things that are maybe outside of our power and control to change or to hold on to in this moment. And that's whenever we start to talk about bad stress and how it can happen. Good stress can also help us in motivating us, okay? Some good examples of this are us preparing for an event. Maybe we're preparing to go on vacation. Now, many of us would see that maybe as a good stressor because we're excited to go on vacation, but the preparation for it, maybe not so much, right? But it's short term. It helps to keep us motivated, engaged in it. An example for kids may be studying for a test, okay? That event in and of itself is stressful, but it also motivates them to be more engaged in that behavior. It's short term. Once they go through and take the test, the stress usually dissipates, right? Bad stress. This is what we all want to be very mindful of and pay attention to because it's chronic. This is every day. If every day we are kind of waking up and feeling almost like a sense of dread, a sense of exhaustion already, if we notice that our mind is just consumed with constant worry thoughts, or they're very ruminative in nature, where it's almost like we have this record player kind of going in our head that is just focused on the next thing that can happen, right? It's usually control-based, okay? So what that means is that most of our worries and most of our concerns aren't things that we can solve in this very moment, right? You're shaking your head, right? They involve other people. They involve money. They involve maybe different aspects of our health. They involve our house, okay? But it's all things that tend to be outside of our control, but yet our mind tends to just kind of latch onto it, almost like a bulldog's kind of grip, and just sit there and hold on to it and replay it constantly within our head. For some people, stress just manifests itself in terms of what ifs. And once we get on the what if train, it goes forever, right? Because we what if all day long. Almost every single scenario we come up with, we got another what if that goes along with it, right? And so it just sends us on this continuous goose chase and really drives up our system, really consumes us again, and doesn't allow us to be present. It doesn't necessarily allow us to take purposeful or effective action whenever these things are happening. And whenever we look at this, common stressors, everybody's number one stressor, who you are, is people, right? This could be your relatives, your spouse, your co-workers, your kids, your grandkids. Any human being is often another person's greatest stressor. And they're often the ones who we're trying to control. But can we do that? No. And that's simply right there what drives so much of our chronic stress, is our interactions, relationships, perceived notions whenever it comes to other people. Of course, money, right? We still haven't figured out a way for it to grow on trees yet, okay? So that often serves as a stressor. Jobs, maybe it is our job. Maybe it's not having a job. Maybe it's not having one that's fulfilling or working within a challenging work environment. And then our health. Because many of us who have been diagnosed with chronic medical conditions feel like our health is outside of our control, right? Many of you who I see a lot of familiar faces in here are aware that I'm a type 1 diabetic, okay? A little bit different than type 2s, but it would be very easy for me to sit there and think that my health, my wellness is outside of my control because I have this condition. But what we try to teach within here and within our lunch and learns and even within my clinic is that notion of control is really within our hands to kind of change and to motivate us to do better with our own health behaviors. And so this is even where heart disease can be within our control in order to try to change, in order to improve, and in order to help others around us by talking about a few of the things we're going to discuss today. So, any other common stressors folks can think about? I mean, really, other people just kind of sum it up, right? So, all right, underlooked symptoms. Again, most of us are pretty good at saying whenever we're stressed out, and that tends to just be in those moments whenever we're feeling really overwhelmed, almost like an acute moment of stress, kind of like we talked about a minute ago. But if you notice that within yourself you're experiencing any of these symptoms, frequent headaches, okay, just seem to come on, maybe a dull headache, not necessarily a migraine. Grinding teeth is really, really common, all right? Oftentimes people don't know that they're grinding their teeth until they go to a dentist, And then the dentist sits there and says, hey, did you know that you grind your teeth? No, I didn't. Well, you do. They're almost flat on top. Okay? So many referrals I have at times come from dentistry because they notice that people are grinding their teeth and are unaware of it. Interesting, huh? Never think of it, but that's how stress is manifesting within that person. Lightheadedness, okay? Frequent episodes of lightheadedness, increased blood sugars. We work with a lot of diabetics in my clinic and in our diabetes program here, and one of the things that we focus on teaching is that chronic stress on average can raise your blood sugars about 75 points. Isn't that something? Stress alone has that kind of an effect on your body. Your blood pressure. A lot of times whenever people are really stressed out, well, I can feel my blood pressure rising. Okay? Direct correlation between the two. And that makes this real important. Other things we might not be quite as mindful about is difficulties with concentration. We just find we're not able to pay attention maybe to as much as what we used to. Learning new tasks can serve as a challenge. So imagine being diagnosed with a chronic health condition like congestive heart failure, which that diagnosis itself is going to stress you out, and then you're supposed to learn how to manage it. Well, that stress right there, just from the diagnosis alone, can serve as a barrier to your effective management of that condition. See? Makes it really, really, really tough, and that's where these things are so important for us to be engaged in. Memory. So remembering things can be a big challenge. And that's because stress affects attention. So if we're not able to pay attention to things, we're not able to store it, and then we're not able to retrieve that much of it. So it's this beautiful three-part system that just disintegrates whenever we're very, very stressed out. Okay? GI problems. Woo boy. A lot of folks, they manifest and hold on to stress in their stomach. Okay? And so in working with that and understanding IBS symptoms, having no appetite even, getting stomach cramps, all of that can be a result of stress. Okay? And so we want to also pay attention to that if we're having increased episodes or problems within our belly. Muscle tension. You just feel it everywhere. Different people, again, hold on to stress in different places. And this is another thing that's important that's kind of good to do is self-scan on. Some people hold on to stress back up here in their shoulders, right between their shoulder blades. They can just feel it there. Some people, it's just right up here in the tops of their shoulders, and they always carry their shoulders up around their ears like this. Others, they just may be real tense. One thing that I notice a lot of folks doing is holding their breath. Okay, that's probably one of the worst things we can do when we're stressed out, because then we become hypoxic. Our brain's not getting oxygen. Okay, so then we're not able to process or respond to anything accurately. But most of the time, whenever we're stressed out, we're sitting there going. If you've ever been around a toddler, like a real young kid, and they're starting to get real fussy, and they go like that to like hold their breath, it's because they've seen some adults around them doing it. These kids will tell you a lot about yourself, all right? And what's happened in their environment. The holding your breath can be another one too. So, real important, understanding, recognizing these underlying symptoms within yourself and with others can be very helpful in taking this control of this and preventing it from having some serious effects on our heart. So in understanding this and kind of breaking down what we were talking about with the good and the bad stress, again, this comes back down to our bodies and how they're made. Every single one of us has a natural fight or flight system within our body. And that fight or flight system within our body was designed to alert us to danger and to help us to decide what we needed to do in that moment to survive. That's what it was pure design for. So if we encounter a bear in the woods, am I going to sit there and try to fight it, or am I going to try to run off? That's what it was designed to do. Our body was not designed to be confronted with that bear every single day, every moment of the day. It's not mechanically built to do that, period. But our lives, our brains have changed so much over time that, again, that perceived threat is no longer on that bear. It's on all this huge amount of worries that seem to just kind of float around our world, our head, and in our environments. And by us focusing on all of those worries, we are driving up our cardiovascular system, because at that point in time, our adrenaline and cortisol levels start to increase. They're released into the bloodstream. Our heart rate increases almost automatically. Okay? Our blood pressure increases. Our GI system starts to change. If we're in a very, very stressed out state, it's either going to shut down or it's going to want to release everything that's in it in that moment. Because again, from a biological standpoint, it's designed to fight or to run. And the only way to do that is to stop what's happening or to release everything that's there. Okay? That is why so many people who have GI problems like IBS have that type of response to stressors. And it's real important that we try to manage that. Boost glucose into the bloodstream. So again, as part of that whole fight or flight, whenever sugar gets released into the bloodstream, it's designed to kind of help us to get in action, to start to move, to start to run. It's supposed to give us energy. But whenever that is constant, it's putting us at risk, significant risk, okay? Again, this is designed to be a short-term response. However, whenever the stress is chronic, this can have significant long-term effects on the heart as it is constantly being taxed. Constantly being taxed from this. So what can we do with this? We need to really identify your own personal triggers and your own personal symptoms, because every single person in here is different in how they respond to things, okay? And how they manage different relationships, people, all of that. So one of the best things that we can do is notice whenever we're experiencing a lot of stress to, again, take a few moments, okay? And really kind of do this self-exam. How frequent is this happening? Is this stressor that I'm encountering happening daily? Is it happening just 3 times a week? Is it happening just while I'm at work, right? On those work days? Does it involve all people or just specific people? And if so, who? Honestly, in those cases, it can be because this person is toxic to us, or we might be engaged in like a codependent relationship, which can, again, be very taxing on us and means that we're not partaking in a lot of good self-care at that time. Is it situational? Is it just whenever you're put in this situation, do you feel completely stressed and just overwhelmed? Or whenever you get over here, is everything fine? So maybe as soon as this is how it is for some people, their home may be their stressor, and their work environment is their daily vacation. And the stark difference between those things is so apparent to them that once they recognize that, then they're able to start to make some changes. And so it's real important that we take this time to do it. Is it seasonal? I mean, does anybody like the weather that's happening out there right now? No, it's so unfortunate. And that's a big stressor for a lot of folks. I mean, I can't tell you how many people I was just talking with today that were like, I just know I'm going to feel so much better when the spring gets here, right? Growing up in West Virginia, I always refer to this season as it's wet, it's cold, it's gray, and it's muddy. Some people call it winter, okay? No, that's really what it is, right? And so it makes it very hard for us to get outside. And again, being a human, just as an animal in of itself, we're not meant to stay within boxes. We're meant to also be outside and to have that exposure to sun, to fresh air. And whenever we're in this type of period, we just tend to hibernate. And that never does our body or our kind of spirit any good. If we notice that we're using this E word a lot, exhausted, okay? Exhausted is from emotions, period. If you say you are tired, it's because you've worked on the farm all day, right? It's because you've done nothing but clean house. It's because you ran a bunch of errands. If you are using the word exhausted to describe yourself and how you're feeling, that's because of emotions. If you hear others around you use that E word, that's the big key with this, that this is actually the situations, the stressors are taking much more of an effect than what you realize. Restless. Restlessness is very common. Like you just have so much worry-filled energy, but you have nowhere to place it. And so it ends up in a lot of pacing, a lot of hand-wringing, a lot of what I call buzzing. Like you're just buzzing around, just doing things that never really help you to kind of get ahead, but give you a little purpose in that one moment. That in and of itself can be from stress. Anxious. This is different. This is where that worry comes into play. That sense of dread can come into play. And then being depressed. Okay? And depressed is just whenever you just don't have that motivation. You don't have that drive. The weight of the world and everything just seems to sit there right on top of you. It makes things like self-care, taking medications, very, very difficult and a big challenge to kind of to overcome. This is especially important to notice in heart disease patients, okay? Because physiologically, whenever our heart has been through a whole lot of stuff, we may not feel like we have a whole lot of energy in order to do things, particularly after open heart surgery. Those of you who may have been through it, who might be cardiac nurses that are in here right now, or patients. One of the number one things that happen to people after cardiac surgery is they become depressed. You're shaking your head.
My mother, she was awful.
Really? Right after heart surgery?
Yeah, it took probably 6 months to recover from the whole ordeal.
Sure. Absolutely. And the reason for that is, it's hard to for us to sit there and conceptualize what all happens whenever we have that surgery. I've actually been privileged enough to go into it and be in it this a few times. It's a lot. It's trauma for your body. But then the inability to get out and do like you were once doing, that in and of itself is what we see the depression come in. Okay? For women, but also for men. For women, because they're often the caregivers of the family. They're the ones that are fixing the meals, that are doing the laundry, that are, being the wife, the mother, the grandmother, the be-all to end-all to everybody, and happily maybe in some cases doing that. But whenever that sudden hard break kicks in and they're not able to, they just don't have any purpose, or they feel very restless a lot of times. Men, the same thing. You can't drive for about 8 weeks after you've had open heart surgery. That's a hard reality to come in touch with, because not only are you feeling physically like you're unable to engage in certain things, but in some ways your independence has also been hit with a little bit of a brick. Although temporary, it's an unexpected change that comes a part of that. Another thing just to be mindful of when we're talking about this with anxiety, if someone does go underneath open heart surgery, it's real important to follow up with a cardiac rehabilitation program or to get connected with one, because the best thing that you can do is start to understand your heart whenever it starts to move. Whenever you start to move and it starts to beat, put it that way. Because a lot of times whenever folks go through that type of procedure, they're afraid to exercise. They're afraid to get off the couch and start moving again, because they associate that increased heart rate that comes with physical activity with a heart attack. And so instead, they'll end up vegetating or taking on even a more sedentary lifestyle. And that's actually what causes the next event. It's not so much that re-engagement in that type of activity. That's the life-saving component of it. You learn that by going through a cardiac rehab program, or by staying in deep touch with your cardiologist, so that way you can understand what good, healthy aerobic exercise and heart rhythms are. Critical whenever it comes to helping folks that do have heart disease. All right, know your risk factors and your ideal numbers. Every single person in this room is a potential heart patient, period, okay? But how? How are you a potential heart patient, and how are you different from the person sitting next to you, from your spouse, from your kids? We have to know your risk factors, and we have to know what your ideal numbers are. So when we look at risk factors for heart disease, we can basically break them down into non-modifiable and then modifiable. So not changeable, changeable, okay? Age. Gosh, wouldn't it be cool if we could change our age? I know, right? Maybe, I don't know. I'd like to pass the fast forward button sometimes, right? The slow down, and then maybe the skip ahead. Rewind, maybe some. But getting older, your risk for stroke doubles every decade after 55. That's kind of striking, isn't it? Doubles. Every decade after 55. Real important to be very mindful of this, okay? Our sex. Men are at greater risk of heart disease than premenopausal women, okay? But once past menopause, a woman's risk is similar to that of a man's. Amazing how that one kind of physiological difference can do this. Risk of stroke is similar for men and women, okay? Family history. Family history is critical. Just to kind of give a personal example of that, my dad is an extreme, has always been very physically active. It was just, I grew up as a weird kid. We didn't drink pop, as kids. We always played outside. It's foreign concepts maybe, right? And he has always done martial arts, ran marathons, yoga, very self-help, very aware of his body. Well, about 15 years ago, he actually was going to physical therapy. Put yourself in this position. He's going to physical therapy because he thought he tore his rotator cuff in karate. And he was upset because he was not able to strike and to throw people quite as well as he was, okay? His physical therapist, who quite honestly saved his life, who still is in practice, he's actually in the Senate right now of West Virginia, looked at him and said, "Rick, I don't think that it's your rotator cuff. I think it's your heart." And my dad, he's an educated man, he kind of looked at him and was like, "What?" and started laughing. Well, my dad looked at his life. So he looked at his lifestyles. Not smoking, doesn't eat, fried foods, exercises daily, right? Likes about a glass or two of red wine a night. We think that's good for your health or whatever. But he looked at all this and was like, "I don't understand." Well, he went on through with the recommendations. On a Monday, he went for a stress test. On a Wednesday, I took him to his heart catheterization. And at that point, we were talking and joking about, well, let's go to Tudor's for breakfast, right? Let's go ahead and have all this fun stuff. And they came out and said that he had 5 blockages in his heart, 99% or greater. On Friday, he was scheduled for open heart surgery. This is 15 years later. He's continued to run marathons. He's continued to be active. He's an active yoga teacher, does Tai Chi for heart disease kind of a things. But whenever we looked at family history, his dad died at like 50. His brother died at 50. The fact that he was upset about not being able to fight in karate was what got him to the doctor. Because I guarantee he wouldn't have went for any other reason. He has an ICD implant, and he still has to stay active. He still has to stay engaged in things. But that right there is an example of family history. So even despite taking good care of yourself, family history as a non-changeable behavior can be a huge risk factor that we all need to be very, very aware of, okay? And again, didn't have typical symptoms. What that actually was angina, okay? He just didn't know it. So, very interesting. Whenever we look at modifiable behaviors, what we're looking at here is cholesterol, high blood pressure, physical inactivity, being overweight, smoking, diabetes, and diet. All of those are changeable. Challenging, but changeable. And that's where we really want to start to focus on if we're going to try to reduce our risk, okay? And understanding your ideal numbers. We always encourage people to make an appointment with a primary care physician and sit down and really talk to them. You know, every person that is on Medicare has an annual well visit that you go to your doctor for. Utilize that time to understand your different risk factors for conditions, to ask questions and to really get a good understanding of what your ideal numbers are for your life and for your functioning. It's critical that us as patients take that active role within our healthcare. Our doctors can't do it alone. Okay? We can't just keep going back to them for a pill or to fix us. We have to be the cultivators almost of that change. So according to the American Heart Disease Foundation, what we kind of are general things we want to be mindful of are these types of numbers. So the 120 over 80. Some people like a little bit stricter control of 110 over 70. Again, talk with your healthcare provider. Get connected with a family practice physician that you feel comfortable with, a nurse practitioner that you feel like you can talk to, a PA that you can really listen and understand what is going on with your heart health. We've got dozens of them here that they would love to be able to help folks with. Understanding what your fasting blood sugar is. Okay? If you're a diabetic, it might be a little bit different than if you're a non-diabetic. Okay? Understand what that is. High blood sugars put you at risk for heart disease. If your blood sugar is over 200 constantly, you're doing damage. Okay? You're doing damage, and you've got to be aware of that. Being mindful of that, you know, 3-letter bad word, I guess, right? BMI. Okay? Where are we at? That's actually still a good measurement of our health, because our body and our heart may be having to pump harder because of that. So we really want to take a good exam of that as well. So what can we do here? Again, you hear me talk and preach about this a lot, but talk to your doctor. Okay? If you can go into your doctor with an active plan, like, look, doc, I know I've had hypertension, high blood pressure, and you've been treating me for it for about 15 years. What else can I do to help to improve this? What's one thing that I can do to help improve my high blood pressure? I'm not asking for anything more than one. Because truthfully, if we're just able and willing to make one change in our health-based behavior, it's kind of like throwing that rock into a pond. It will have that ripple effect. Okay? But go in there with that intent to just know, what is one thing that you would like for me to do differently in order for me to help to improve my health. Okay? Get engaged in that. You know, take that. If you ask for it and he gives it to you, follow through, right? Go for it. Outside time. I say this a lot in some of my different presentations. If there is anything I could prescribe, and as a psychologist we don't prescribe medications, it would be outside time. Again, as humans, we're not meant to be constantly in boxes. It's just not part of our design. Okay? Anytime we get outside for as little as 20 minutes, our respiration slows down, our heart rate slows down, our blood pressure immediately goes down. Okay? The effect of the outside is so soothing, so calming, so distracting sometimes from all the different stressors that we have going on, that it is absolutely one of the most therapeutic and helpful things that we can do for ourselves. I know the weather is awful. Okay, no one wants to go outside and kind of look at the rain this way, but I challenge you that on days like this to find something beautiful. You know, it really does kind of look pretty whenever the clouds start to roll in. I like to watch thunderstorms, right, come in. Or just to see the rain falling at different rates and rhythms. Just paying attention to that can almost put you to sleep because it's so relaxing. To simply listening to the rain fall, preferably on like a tin roof, right? Does anybody still remember those, like on a barn roof or a tin roof? Very, very nice, all right? Even whenever it's super cold outside, take a blanket out there with you, a nice cup of tea or coffee, and just sit outside and enjoy it instead of just staying inside. You would be surprised at what that can do for you, honestly. Doing that at lunchtime, if you're working, Stepping outside for a few minutes can be that refreshing break that you need before you go back in. You know, it's just a good habit to try to get in, just to kind of go outside, all right, to get that fresh air. Activity. Activity is my replacement word for a dreaded I think it's like 6-letter. It's an E word. Not good at counting, better at spelling. Okay, I don't use it a lot because it often turns people away. What's the E word I'm talking about here with activity? Exercise. Yeah, exercise. Everybody's too tired to exercise. Nobody has enough time to exercise. You won't have time to spend with your family, to spend with your loved ones, if you're not. Okay? With diabetes, with heart disease, with COPD, with all the different challenges that we face, our bodies are made to move. Again, from a very physiological, design-based kind of approach, our bodies are meant to move. Okay? Whenever they don't, that's when it becomes more difficult because of atrophy kind of sinks in. Because maybe we're not moving enough and our muscles get weak, our tendons get weak, you know. We might not be wearing the right shoes, or there's different challenges or barriers that kind of come into us. But any amount of exercise you can do is going to be preventative. It's going to lower your stress completely and totally. If you're looking for a place to do it, you walk 7 times around this circle here, and it's a mile. That's pretty good. Okay? You can do it anytime we're open, right, Patty? You can come here. We have a lot of walkers. You see our employees a lot of times. If you come here at lunchtime, between like 11 and 1, you'll see a bunch of people in scrubs walking around this place in circles. Okay? It's because we have that availability to do so, and we're taking advantage of it. Some of them are part of a wellness program, but it's just an opportunity. If you're here already seeing your doctor, you know, take a few minutes. Maybe do 3 before and 3 after your appointment. Okay? You might feel a whole lot better. Okay? What? You did 1?
I do good enough to do 1.
Well, that's perfect. 1 is enough. 1's a great place to start, though. So we always want to reward us for doing anything, because there's many people that do nothing. And so that 1 matters. Okay? No matter what, that 1 matters. And that's what we want to get in the habit of doing. Just 1 thing. If it's 1 lap, that's what it is. But doing some type of physical activity is so helpful to our heart because it gets it in a good rhythm. It helps it to become stronger. It helps it whenever insults come onto it. So the fact that my dad was so active and healthy before made it easier for him to recover from open heart surgery, because his heart was a muscle and it was used to working that way. So whenever it went through that trauma, it still didn't like it a whole lot. But because he worked on being healthy before and he was healthy afterwards, it really helps him a whole lot get back to his activity level. Healthy nutrition. What's the word I'm replacing there? That's a bad 4-letter word. Begins with a D, diet. All right? Who wants to go on a diet? Nobody. That word just needs erased, right? It's not a good word. But nutrition. And this is something that we focus on a whole lot too, because food is not designed to be comfort that we use it for, right? I mean, you're growing up here in Appalachia, what's some good comfort foods? You're just smiling at me. What?
Fried potatoes.
Fried potatoes, right? Oh, that's a good one. With like some butter on it that gets real nice and crispy on it.
Onion.
Onions, okay, good for you. What's another one? Tutors, right? Those big old biscuits that they have on there, right? Classic West Virginia food. What else?
Beans and potatoes.
Beans and potatoes. And with some cornbread on the side too, right? Okay. And greens, right. Ramps if you got them, I guess, for some folks, right? All right, what else? Chicken and dumplings. Some people are big chicken and dumplings people. Macaroni and cheese. What else?
Fried chicken.
Fried chicken, right? Desserts, cobblers, pies, right? All of these things are what we often refer to as comfort foods, okay? We also tend to think of foods as being rewards or punishments, right? So if I've been good, I can have a cupcake. But if I've been bad, I have to eat broccoli. Is that fair? No. No, it's not fair. So what we want to think of whenever we're looking at food is as it's designed to be. Food is meant to be fuel for our body to run efficiently. That's what it is. So we want to make sure that we're putting good, healthy food fuel into our body to help it to run efficiently. All right, and what we're looking for with that is making sure we're incorporating a lot of good vegetables a lot of times, right? We want to make sure that we're paying attention to protein and what kind of protein we're putting into our body, okay? We want to look at fruits maybe, but being mindful that fruits sometimes carry a lot of sugar with them. Main things that we want to watch out for a lot of times are carbs, okay? So we want to be sure that we're using moderation or limiting whenever it comes to carbs, even with heart disease, because if we're also a diabetic and our blood sugars are going up, remember, that's going to make it harder on your heart, and carbs are the #1 reason for that. And so the easiest kind of thing to remember whenever it comes to carb is you just really want to have 1 serving of a carb with your meal, okay? And that serving, if you use about the size of your fist, that's pretty good, all right? If you're a diabetic, again, we encourage you to talk to your healthcare professional and learn what's going to be best for you. But just as a general token, that can be a nice reminder, okay? A lot of healthy substitutes are options nowadays, and what we really want to try to get back to too is this thing that's become a fad now, even though it was traditionally the way that we used to eat. That whole farm-to-table concept, right? I mean, all these restaurants are offering farm-to-table food. My question is, what were you serving me before that? Right? So we really want to think about that. Going to farmers markets, local grocery stores that utilize that kind of stuff. We want to get back to really making sure that we are putting food into our body that's as close to the source as possible, because it's going to have the greatest amount of nutrients that we're going to need in order to do the things that we need to throughout the day. And again, it's what our body's designed to kind of have. And so we want to try to get back to that as much as possible. Mindfulness. This is a buzzword that's kind of come around within the last like 5 or 10 years or so, but it's really been around for about 2000, okay? And what mindfulness is, it's just trying to keep our thoughts and everything focused on the here and now. And I know that that is such a challenge whenever we're all sitting here thinking, well, I got to be here in about 15 minutes. I got to be there. I've already late for this, or I should have done that today. Being mindful is just trying to bring yourself back to this current space, to this current moment, and what you have at hand to kind of control and see, okay? So whenever you find yourself getting stressed out about something, I tend to like have this rule that I try to work on for myself as well as the folks I talk with, my patients, is if it's not physically in your hands right now to control or change, you need to let it be. That's hard, I promise. But what you're doing is also harder and not working, okay? I'm going to offer you something that's hard, but that will work. So if it is not within your physical reach to try to control or change right now, we just need to kind of put it down. That doesn't mean let go. Like, I'm one of these weird people that says it's impossible to let things go. Don't try it. It ain't going to work, okay? But we can put it down. We can let it be just for a moment. We don't have to pick up that hot cast iron skillet that we've been cooking all day and carry it around with us, right? We can let it be and then come back to it whenever it's manageable. And we can work with it, okay, where it's not going to burn us or hurt us, okay? And that's what we try to focus on with mindfulness, is just staying present right here and right now and what I can do. Many different strategies and exercise for it, many different apps that you can actually get on your phone that can help us to be more aware of it. It can be doing some of those scans, like those body scans that I was talking about earlier, noticing how stress manifests in itself within you. It can be about mindful eating, actually paying attention to what you eat. You know, mashed potatoes are a good example of that. I use that a lot. You can tell if mashed potatoes are cooked in water or in chicken broth if you really pay attention to them. You can pay attention if they're instant or if they're real. If they've got cream, if they've got butter, if they've got milk, sour cream in them. If you really eat it pretty mindfully, you can pick those different subtle differences out from it. That's what some of this stuff comes back to, all right? Taking the time for self-care is a part of this, because in order to reduce our stress level, we have to be focused on ourselves. And if we're focused on ourselves, we're also taking good care of our heart at the same time. So with that being said, what questions do we have? Anything anybody can think of? Lots to digest, right? Along with your lunches.
If you're real stressed out, can that put you in a really dark place?
Absolutely. Absolutely. That's one of the things that we try to focus on teaching people to be aware of, because when that happens, we don't see a way out, right, of the stressor. And whenever we don't see a way out, oftentimes we can become very hopeless and depressed. And truthfully, that's whenever somebody's at risk for things maybe like a heart attack or a stroke, but also suicide. And that's something to really be mindful of whenever stress can kind of get to its extremes on this. I do have another handout I want to kind of give you guys to look over and to maybe use this as like a discussion point with your doctors, or to help you in that kind of self-scan that we talked about. What this does, and it's two-sided, is it's going to kind of go through the stress and its effects on your body. Okay, on all systems of your body, and it's actually from the American Institute of Stress. So we actually have one of these things, right? An Institute on Stress, because it impacts every single, thanks Patty, health condition that we have. And so again, by learning to manage it, by learning how it kind of manifests within our own selves, we're able to improve our total wellness with this. So on one side of it, you kind of see this person just kind of, autonomy of atomy body, let's put it that way, that you can kind of see, how it's affecting the different areas. So we're talking about even fertility problems. That's one thing whenever I work with young women, people who have PCOS or women within their 20s that are trying to get pregnant for long periods of time, your stress level can actually be something that keeps that from happening or puts you at greater risk for miscarriage. Okay. Weakened immune system. Chronic stress weakens immune systems. Okay. Again, we want to be aware of this, because if we find ourselves getting sick or staying sick longer, okay, it might not just be a bad bug. It might be bad stress too. Okay. Stomach problems, as we talked about. Insomnia is very common. On the other side of this, it has the person just kind of sitting there holding their head into their hands. And what we're looking at there is a system by system kind of breakdown as to how stress really affects your body. And it's good for us to kind of pay attention of that again, based on our self-scan. Where is stress manifesting itself within our body system? And how is that then affecting our health? All right. So take some time to kind of look towards some of this stuff. And again, bring these concerns into your doctor, especially if you're already a heart patient. You want to really be aware of this and go into your doctor with that intent. What is one thing that maybe I can do to perhaps reduce my stress level, to reduce my blood pressure, to help out with my eating habits, to help me to exercise a little more? All of that can be the biggest steps that we can take towards long-term health improvements, and that one lap matters. So I love that you said that. I mean, that's like a nice little slogan to have, is just to kind of really be very appreciative for that and mindful of it, and to be aware of all of these things here, because it can be very preventative and helpful. So any other questions or comments?
This was the most healthy food I've had in months.
Was it really? All right. Well, that's good. Well, sure. And food costs are a big barrier for lots of folks. And I think that thankfully our medical community is starting to recognize that. And one of the things that we're trying to look towards developing are things called like food pharmacies. Have you ever heard of that before? No. Basically, sounds funny, doesn't it? Like a pharmacy is where we go to get drugs, right? Medications. But going back to this presentation, food, nutrition is the most important thing we can kind of also put into our body to help our health. And so the idea behind these food pharmacies is that maybe you go to a doctor and you have this diagnosis of a medical condition. Well, we're going to give you like a basket of food with some recipe cards, okay? So that way that you can learn how you can substitute this cauliflower for potatoes. And I promise you that cauliflower is a whole lot cheaper than that sack of potatoes, right? How you can use squash and zucchini, which will grow like weeds in almost any environment, including West Virginia clay, right? To really, you know what I'm talking about if you're a farmer, to really help to improve your kind of diet, you know, as a nice substitute for noodles or just a nice kind of alternative meal to have at your table. And so those are some concepts that are getting ready to kind of come out. But the idea being is that it's kind of that old metaphor, and I'll probably mess it up because I'm not real good at saying it yet. We don't just want to give people a fish, we want to teach people how to fish, right? We want to teach people how you can use these types of things to better your health and not just give you something, because lots of studies have actually been done on this and show that if we just give people food, whenever we stop giving people the food, or even whenever we still give them the money maybe to get the food, the health benefits go away because we all go back to those other habits, or we just don't continue doing them because maybe we don't know, there's a knowledge deficit there. So we got to teach people how to fish. We got to teach those alternatives, the cheaper ways to kind of get things, so that way we can improve our health. But that's an important notice that you just had here. So maybe one of the goals is like whenever you go to your doctor, what are some list of some inexpensive foods that I can get it that are going to taste good, you know what I mean, but that are going to be healthy for me too, that are going to be lasting, that my family will eat, okay? That's important. We got to make this easier. Farmers markets are one of the best things that we can go to. At some farmers markets, they actually will take double your SNAP dollar. So that's a good thing. So if you are on any type of public assistance or know other people that are, farmers markets, some of them, you'll have to ask which ones, are really good at trying to help people get the most for their money and the most healthiest food for their money.
14th Street West.
That is it. They do a great job. 14th Street West, Wild Ramp, right? So yes, those are some options. But again, that's what we want to kind of focus on. So any other questions folks have? All right. Well, be sure to check us out on Facebook. Like, share, comment on any of the posts that we have on there. The more people that we can promote this outreach to, the healthier our community is going to be, the healthier we're all going to be, which makes our healthcare costs supposedly go down, right? So focus in on those things, get connected with your doctor, go in there with that what's that one thing question. All right? Thank you all so much for being here. Greatly appreciate it.